Individual care and attention are the keys to improving the mental health of aged care residents. As many as 160,000 Australians live in aged care facilities. Almost half of those suffer severe depression.
Margaret Dahl moved into aged care in Brisbane when she could no longer cope on her own.
Oh, how are you?
Cold.
A program being trialled at her facility last year made the transition easier.
These three are sisters, is that right?
Yes.
Mrs Dahl was assigned a key worker who got to know her and make sure she was adjusting.
She's just not a number here, she's actually somebody who people have gone out to find out about.
A new study says 44% of aged care residents suffer depression, but it often goes unnoticed.
Some research findings confirm the experience of entering an aged care facility is associated with guilt, anger, despair, resentment and general psychological distress.
Researchers found it was important that carers and nurses be trained to identify depression and know who to contact. The 23 staff and 7 residents involved in the study spent time walking and talking and compiling a book of memories. Most responded positively to the extra care and attention.
Keeps people involved with life, because often when people come into nursing homes, sometimes they feel like they've just been put on the scrap heap.
Aged care providers want the federal government to help fund the program nationally.
The numbers of people who are going to be over 70 and needing this type of care is phenomenal.
We'll now look very closely at all those recommendations and see what action we can take in the future. There certainly have been some very positive outcomes.
The government will spend more than $40 billion on aged care over the next 4 years. Christina Harrison, ABC News.